Good morning, everybody. My name is Kristen Cimino. I will be the host of this webinar today. Today we will talk about the Blue Cross Blue Shield of Nebraska 2020 product enhancements for our small group and mid-sized group products, effective, again, for 2020, so effective January. I'm going to go ahead and put the phone on hold just for one more minute and see if we have any other attendees come in late, and we'll start again around 9:02, 9:03. Okay, we will go ahead and get started. Again, my name is Kristen Cimino. I am the Small Group Product Manager here at Blue Cross and Blue Shield. Just to get started with some housekeeping items, if you are new to our webinars, all lines will be muted throughout this webinar. If you have any questions during the presentation, you can enter them in the question box located to the right of your screen. The questions will be answered at the end of the webinar, and if there's anything that I'm unable to answer at the time, we are documenting all the questions and recording this webinar as well. So we will type up all the questions from this webinar as well as the other two sessions we're hosting, and make those questions and answers available on our website as well. There should be no issue with time today, so we should be able to get to the questions we can answer. And during the presentation, your chat box may minimize. If it does, click on the orange arrow that will be on the upper right side of your screen to bring that back. All right, let's get started. So today, here's the agenda. We're going to go through the mandates that are changing or that require changes for the products, medical benefit changes, as well as changes applicable to the Blue Pride ACA product only. We'll walk through some changes to the pharmacy benefit, legal document impacts. We'll walk through the 2020 HSA minimum and maximum changes, as well as plan design changes for some of the product lines and updating cost shares, etc. And then we'll end with the questions. So starting here with the mandates, there's really no federal mandates that are impacting these product lines for 2020. However, the new state mandate for 2020 is going to be the LB15 Children of Nebraska Hearing Aid Act. So here's some information on that act if you are unfamiliar with it. It applies to, per the mandate, it applies to group or individual insurance policies, except for the small groups who fall under Section 44-5260, which is our Blue Pride ACA product. The law applies to self-funded non-ERISA employer plans. However, we've also made the decision, the business decision here at Blue Cross to allow this mandate to be applicable to the Blue Pride ACA products as well. So we're going to cover the hearing aids as this mandate requires on our Blue Pride ACA product, even though it doesn't require it, and then our Blue Flex product as well, which we're talking about on this call, and our Blue Freedom product, which again we're talking about on this call as well. Again, this webinar is specific to those small and mid-sized group products, which again are Blue Pride ACA, Blue Flex, our level funded product, and Blue Freedom. This Children of Nebraska Hearing Aid Act is effective January 1, 2020 upon renewal or new sales. So if you have any groups that are 12-1 renewal, 11-1, 10-1, 9-1, they will not have this benefit on their plan until 2020's renewal. There is a definitions at the bottom of hearing aid and hearing aid impairment per the mandate. Something to note as well is we are going to continue to allow bone anchored hearing aids outside the limits of this mandate, as we have already been covering regardless of age. There will be no changes to the way we cover those bone anchored hearing aids. They're going to cover them the same. We're going to cover the batteries as we do for other DME items subject to the limit. And then there's going to be a pre-authorization required for the hearing aids. There is a limitation to the hearing aids, as I mentioned previously, which will show like this on the schedule of benefits summary. The hearing aids are available for children up to age 19, limited to $3,000 every 48 months. And the cost share would be the same as any other illness in and out of network. That's really the only mandate that is going to be put on all these products, these 3 product lines. So moving on to benefit updates. Telehealth, there is a fee change per Amwell, American Well, which is the company that provides the telehealth services for Blue Cross and Blue Shield of Nebraska. So the fee is increasing from $49 to $54 for Amwell's primary care physician visits. The main membership base that's going to see this change in cost is going to be those members on the qualified high deductible health plans, where they have to meet their deductible before they see any coverage. The PPO plans that have a $10, $15, $20 copay for the telehealth visits will still have the same copay as the plan indicates. They won't really see that change. This is effective January 1, 2020, regardless of the renewal date. So this is really the only thing that we're going to talk about today that is effective 1/1/20, regardless of renewal date. So this will impact those 9/1, 10/1, 11/1, 12/1 groups as well, starting January 1st. There are 3 types of changes to the medical benefit. So we'll talk about the anesthesia and hospitalization for dental services change. Blue Pride only is now getting the autism coverage, which was already on the Blue Flex and Blue Freedom products. And then we'll talk about the changes to diabetic supplies. So we are going to be modifying the current provision within the oral surgery and dentistry section of our contracts to match the state mandate. So right now our contracts kind of say that we allow above and beyond the state mandate, which allows services for children under 8 years or developmentally disabled. Now we're going to update it and be more clear and match the mandate. We're just trying to make everything more member friendly and consistent, that our contracts match what the mandates are. Let's see. For the Blue Pride only, again, as I mentioned, autism coverage will be added effective January 1, 2020, again, on the new contract, so on renewal. This is really to help groups that migrate between our 3 small group products, Blue Pride, Blue Flex, and Blue Freedom. Some groups change product lines every couple of years or flip between 2 based on size of group. So this is really to help groups be consistent with their benefit offerings when they have to change products. And then regarding the diabetic supplies, they're going to now be covered under the medical benefit for Blue Freedom, Blue Flex, and Blue Pride ACA. So those include needles, alcohol wipes, insulin pump supplies, including but not limited to tubing. Diabetic and insulin supplies such as syringes, insulin syringes, test strips, lancets, lancet devices, and glucose sugar test tablets are covered under the prescription drug program or pharmacy benefit, as they always have been. So again, the change is specific to the needles, alcohol wipes, insulin pump supplies, including but not limited to tubing. This has to do with the formulary change for some of the product lines. We're trying to keep that benefit consistent, the way supplies are filled consistent across these 3 products as well. Not much should change for the members. A lot of major pharmacies are going to be able to bill under the medical benefit right at that same point of sale. A lot of retail pharmacies, Walgreens, major grocery store chains are going to have DME, durable medical equipment, and be able to bill under the medical benefit via that. So they shouldn't see anything, and pharmacies will definitely be able to help members direct them to where they should fill it or could fill it if the pharmacy for some reason is unable to. We'll go through some more questions. So there's some more items on pharmacy we will also discuss here. So for pharmacy changes for Blue Pride, Blue Flex, and Blue Freedom, we'll talk about the mandatory generic penalty, which is dispensed as written 1 codes and dispensed as written 2 codes, also known as DAW1 and DAW2. And we will talk about the new prescription drug list formulary changes for the coming year. So going through the mandatory generic penalty, so our current contract, current benefits only apply a penalty if dispensed as written 2 is written on the prescription. So what this means is if a member fills a prescription from their provider and they request the brand when a generic equivalent is available, they have to pay the difference between the brand and the generic. What we're saying now, effective January 1, 2020, is that even if the provider requests the brand when the member, or when there is a generic available, the member will still have to pay the difference between the brand and the generic. So this really is trying to drive that generic utilization, make sure providers are not just writing dispensed as written because they'll always have, and really try to get that utilization down on the brand category side and get the generics used when they are available. If a member truly does need the brand due to some sort of adverse reaction, medical condition, something of that nature, there is still a way that pharmacies can override or get through that penalty. They would need to fill out an FDA MedWatch form, which there will be some prompts in the claim system, so they'd be educated on how to handle that. But again, we see that as being extremely rare, but it's not impossible for that fee or that penalty to be waived, but they'd have to go through the necessary steps to do so. We'll talk about here the new prescription drug list. So if you guys are aware, each year the Blue Pride ACA product changes drug lists to comply with the ACA mandated pharmacy benefits, pharmacy drug coverages. So there's always drugs each year that they say now we have to cover. And so each year we kind of just adjust the formulary to include those drugs. In 18, the prescription drug list was 61. In 19, it is 62. And then as groups renew in 2020, whether it's 1-1 all the way to 10-12-1, they will move to PDL, prescription drug list 63. The larger change is going to come for the Blue Freedom and Blue Flex products. This has already been happening. So this started upon renewal July 1, 2019. So if you've had any groups with effective dates from July to now, they've already been moved over to this prescription drug list, which is now prescription drug list 40. Previously, these products were on our PDL-10 or our Nebraska standard formulary. We really are moving over to this drug list to just ensure members, again, are getting the drugs that they need at the lowest cost possible. Some benefits with this prescription drug list 40. Some benefits previously covered under the pharmacy benefit may only be covered under the medical benefit. So this not only is that those diabetic supplies we talked about earlier, but there's some IV medications that are now only able to be billed under the medical benefit. So it's very important for members that are now on these product lines effective again 7/1/19 or upon renewals to really evaluate their drugs and check the list for coverage and where it's covered. We are doing our best to let our members of their impact. However, if they change product lines or move from a self-funded product that has a different formulary to this, sometimes it might be hard to catch everybody, but our pharmacy team is working hard to make sure members know if their drugs are covered or no longer covered under this new prescription drug list. For the legal documents, we'll walk through that. So here's just a quick reference guide as to what impacts these changes we've just discussed will have on some of the documents that our groups and our brokers use. None of these will have any influence on the MGA, the Master Group application. They will all be reflected in the contract and member booklet or SPD. So our Blue Flex product doesn't have a COC or member book. They have that summary plan description document, and those changes will be there. As I mentioned earlier, the Children of Nebraska Hearing Aid Act is going to be reflected on the scheduled benefit summary as a new benefit and show the cost share and the limitation. But again, all the rest of them are mostly on the contract. Move over to the IRS changes. So this was published, I think, a couple months ago. So it is out there on the IRS website, but just a quick reference of the changes year over year. So the black was the 2019 minimums and maximums for those deductibles or out-of-pockets and contribution amounts. And then the red is what's changing for 2020. And then there at the bottom, that is the ACA compliance to avoid the tax penalty for the maximum out-of-pocket on a PPO. Okay, so the next few slides, or the rest of the presentation really, is going to be talking about the Blue Pride, Blue Flex, and Blue Freedom 2020 plan designs. For the most part, things are pretty stable, but we'll walk through the changes, starting here with the Blue Pride ACA. So there's just a quick reference here of how we're going to be mapping, since this product they do assumptively renew, meaning if we don't get renewal paperwork, we'll renew them on these mapped products, but they always have the option to change different options, different plan options if they'd like at the renewal. So most of them are staying pretty stable in regards to the plan designs. Not much is changing, and we'll walk through the few changes there are. But there are a couple plan options that are terminating for 2020. That is the Silver PPOC plan and the Bronze PPOA plan. Those are terming, and you can see what we are mapping them to. And we really looked at actuarial values, deductibles, out-of-pocket amounts, really tried to get it the closest benefit. And so the SPC 19 is actually going to migrate, or the closest mapping is to our Silver PPOA plan. We are introducing a Silver PPOC for 2020, but it is a completely different benefit than the 19C plan. So we'll walk through those changes in the next couple of slides, but that's just why we're not mapping it, the SPC 19 straight to SPC 20, because the benefits are actually a lot different. And then at the bottom, you'll see that Bronze plan terming, and it's mapping to that BHA 20. There really will be only one Bronze offering for 2020 in this product. And another key thing to point out is that all emergency care services received in the hospital emergency room will be subject to the in-network deductible and coinsurance on all options going forward in 2020. So here's those two new products or plan design options that we'll have for Blue Pride ACA. This is the Gold PPOC, so the last Gold option, or Gold PPO option. You can see there the copay is pretty stable. And then the new Silver PPOC option, again, if you compared this one to the SPC 19, you would see drastic differences in the deductible and out-of-pocket amounts. This is a higher deductible and that high out-of-pocket max. Really, we looked at, in developing these two new plans, we looked at the feedback we received from our broker community, from our sales team, what they've heard from you guys, and tried to get these two new plans out there. These next few slides I'm going to go through relatively quickly, and again, don't feel like you need to write them all down because we will provide this slide deck out on our website. But I just wanted to show you that all the other Blue Pride ACA plans that we are offering for 2020 between 19 and 20 are changing. If they have changes, not all of them do. If they do have changes, it's very, very minimal. A slight increase in the out-of-pocket or decrease in the deductible. think one of them decreased in a PCP copay. And that was really to make sure we stayed within those requirements from the government in regards to the actuarial values of these plan offerings. Let me go back. So this was the gold PPO-A option. Again, a little increase in that out-of-pocket max. Here is the difference between the gold PPO-B option, slight decrease in the deductible, but increase in the out-of-pocket. This is the only plan that had that change in copay. So that was the silver PPO-A option, slight increase to the out-of-pocket and decrease in the primary care copay. And then the silver PPO-B option, slight increase to both the deductible and out-of-pocket max. And then the silver HSA-B option, slight decrease. And the only bronze option, again, available for 2020 is right here on the right, the BHA20. Again, slight increase in the deductible and out-of-pocket max. We'll move on to the Blue Flex product, which is our level funded product. In the small group market, there are no new plan design options available for this product for 2020. So all the plan options, cost, share amounts, deductibles, out-of-pockets are all going to be the same on the 2020 versions. The only thing that will change on each plan design, or the PPO plan designs, is that all emergency care services will be subject to the in-network deductible and coinsurance for all plan options. Again, so if it had a copay in 2019 for ER services, it will move to in-network deductible and coinsurance. If you are newer to this product or need more information on Blue Flex, since it is still relatively new, we did hold a recent webinar training refresher in August, and it is available on our website with the recording and the slide deck. Moving on to Blue Freedom, again, the same change to this product is that all emergency care services are going to be subject to that in-network deductible and coinsurance. Copays will no longer apply on any of the options. For 2019 plan options, they are going to be the same for 2020, minus that change in the ER services. That's the only change on those plans. And then the RX options are the same as well. We are introducing 4 new Blue Freedom plans for 2020, which we will walk through here in the next few slides. And again, similar to those few Blue Pride plans that we added for 2020, these plans were closely developed with our actuarial team, our underwriting team, as well as the sales and account management teams on feedback that they're hearing in the market of what we need in this product to remain competitive and really help our groups. So the option 70 here is a lower deductible and then the higher individual and family out-of-pocket max with a 20% coinsurance. And then option 67 is a lower deductible and slightly lower than 70, option 70 out-of-pocket. This one does have copays though, and at 50% coinsurance. And as you can see under emergency care and the emergency care services under the mental health section, they are both showing deductible and coinsurance in network. And these are the last 2 options, 2 new options for Blue Freedom, 68 and 69. Again, 68 is that lower deductible and then higher out-of-pocket. This one does have copays and no coinsurance. And then 69 is really similar to that option 70 on the previous slide, but just a higher deductible, same out-of-pocket limits, and then a lower coinsurance of 10%. Okay. And that is it. Not too many changes for this next plan year. So I'm going to put the phone on hold here for a second and just review. If you guys have any questions, feel free to go ahead and type them in now. We have some attendees starting to drop off because there are no questions flowing through, which is good for me. So my email is on this invite, so if you think of anything after the fact, feel free to reach out. Again, we are hosting another webinar this afternoon. If you know of anybody that wasn't able to make this specific webinar set aside for these attendees, we are hosting an open all broker webinar this afternoon. And feel free to register for that one if you have any other questions. That we'll have this recording or a recording of the 3 we are doing, and all the questions typed up and available on our website, hopefully middle of next week. Just look for that. And again, reach out to me if you have any questions, but have a great day and enjoy your weekend.